All right. Do you see the indicator? Yes. Okay, we've got our indicator going here. So now we're recording. So somebody had a question. Patrick, do you want to come up to the mic? I have here some of those PowerPoint slides that I showed you if you want, if you need to bring them up.
Yeah, did anyone have a question on my material?
My question was, you had said earlier that there were not going to be identification questions on the exam. I wanted to know if it applies to the lab system we did or if even included first section for the
You probably, okay. There may be some images on the lab, I mean on the test, about which questions will be asked. Yeah, so that I don't think there's a great number of them, but there are a couple. Okay. Uh-huh. I think you should focus on what was covered in the lectures, okay? So areas that were talked about specifically in the lectures, including the cranial nerve lectures, which is quite a few of them, are what we're going to cover on the test. Okay, so there's more stuff you've gone over in lab than will be on the exam. But the exam is going to restrict itself to the stuff that the lectures have covered. Okay, so thank you for coming, Dr. Bradshaw. It looks like things...
Yeah, if you have any questions, feel free to stop by my office or email me.
Just because of the questions that you ask, I know I'm going to be extremely obvious, and hopefully I'm extremely obvious for all of you, but if I'm not, you have to think from now on pathways, nucleus, recognizing structures in terms of lesion and disease, okay? And the same thing the other way around, lesions and diseases in terms of areas, in terms of pathways, okay? For other courses, you might need to memorize a lot. I'm not saying that you don't need to memorize for this one, you do, but you have to start putting the dots together, okay? I know we gave you a lot of information, a lot of pathways, a lot of nuclei, but I'm going to use one in particular as an example. Let me look for, so when we talk about the vestibular system, when I taught the vestibular system, I stole in between quotes Dr. Harrison's slides on purpose to reinforce that it's not the vestibular system in here and the cranial nerves over there, and I have to study the cranial nerves and then I have to study the vestibular system. No, you have to put both of them together. And then I talk about, for example, the vestibulo-ocular reflex, okay? And you might think, oh, I need to study the vestibular-ocular reflex and also the horizontal gaze, okay? And how the two of them work. And if you pay attention to these two, they're almost the same pathways, except that this one starts in a different place. This one starts in the paramedian pontine reticular formation, okay? But from there, it goes into the abducens and into the muscles. So you can put the two together, okay? What I'm trying to say, again, I'm going to be Captain Obvious in here. Put things together. Don't study the all the cranial nerves and all the nuclei, and then try to study the vestibular system or the visual system. Get them together, because if we go and ask, okay, you have a lesion on the MLF, what would you expect? And if you know your pathways, you're going to be able to answer the question based on the lesion, okay? And the other way around. Again, I'm being extremely obvious, but this is the time when you start putting all the classes that we taught separately together. Okay? I mean, if they have questions, I can.
Yeah, I'm just going to sort of emphasize that, too. At this point, you have to start, as I said earlier, putting a three-dimensional view of what's going on in the brainstem with all of these pathways, and be able to think about areas of the brainstem. You know, when in reality, when there are vascular accidents, a particular blood vessel supplies a particular volume of the brain, including a particular volume of the brainstem for some of those pathways. And so when they cause damage to a region, and that region is going to have effects on multiple systems at once. So you kind of have to, as Dr. Rodriguez says, you have to kind of start integrating all your information so you can think about the spatial arrangement of things in the brain and the sort of spatial localization of functions that also result. And then, of course, there are the pathways, so the interconnections that can be interrupted between different functional systems located in particular places, okay? So think about integrating that kind of information, because that's what those of you who are going to take step one, that's the kind of thing they're going to expect you to do, and on the NBME exam, and we have questions like that on this exam too. So, you know, work through studying that way, okay? And try to interrelate them as much as you can. I have a few specific things then that I'm going to say. I'm going to start with one general thing is, of course, you know your sensory system pathways, right? And you know the motor pathways, which you've been taught so far, which have to do with eye movements, okay? So it's a neuroscience course, you've got to know your pathways, okay? There's been a lot of talk in relation to the diseases that are involved, and yes, we may ask you some question about diseases. We're not going to ask you about treatments, unless it's sort of a hypothetical, conceptual one, like, would you use GABA, you know, would you enhance GABA function in this particular situation, which is really conceptual. We're not going to ask you questions about treatments of diseases. We're not going to ask you, for example, to look at a retina from one of the Dr. Kimbrough's lectures and tell me what the disease is in the retina, okay? But we will kind of want you to know the basics of the important diseases of the retina and what characterizes them, okay? So don't spend a huge amount of time memorizing images and their relationship to the diseases in that particular, as it relates to the eye. What else do I want to say? I was going to bring up Dr. Kimbrough's PowerPoint, if I can do that. Let me see, how can I get to D2L from here? There's no quick route to it, is there? We've got to get to Mozilla? Yeah, we have to go out through this.
I don't think there's another way. I don't
Yeah.
know any other.
Is it going to let me go? Doesn't look like it's going to let me go. Let me try this one. There we go. Okay. All right. Here we go. I just am doing this because there was an error in one of the slides. And it's really kind of a simple typo, but I didn't want it to completely mess you up. So let's give it a minute here to bring up. What else did I want to say? Oh yeah, and when you're learning the pathways, and especially in relation to the neuro-ophthalmology, you want to know your pathways and what the tests are telling you, and the tests for making sure your pathways are functional, right? And you know what they can tell you, what certain tests can tell you about brain function, and that's an important thing for you to know. Let's see what we can get here. Okay, so on his slide, it's number 44. I don't think this is really, I think you know this from my lecture, but you might have been confused because there's just a little error on this selection. Okay, so he's talking about the difference between a lesion of the oculomotor nerve and a lesion of an oculomotor nucleus, okay? Now, if you affect the nerve, you're going to see deficits in one eye, right? If you affect a single nucleus, right, so just the nucleus on the right side, what's going to happen? There's one small issue, right? It's the superior rectus muscle is controlled from the opposite nucleus. So if you damage the right nucleus, you're going to see a little problem. You might see a little problem with the superior rectus muscle in the opposite eye. Okay? Now, the problem with his slide here is that he put contralateral abducens nucleus, and he means contralateral oculomotor nucleus, okay? Because the superior rectus muscle fibers come from, or the neurons, axons going to the superior rectus originate in the contralateral oculomotor nucleus, okay? All the rest of them are ipsilateral. That's bilateral. Oh, oculomotor. Yes. Does he have that up there too? You see, yeah, no. That's also oculomotor, yes. Yeah, that's supposed to be oculomotor. Bilateral from the oculomotor. And same with Edinger-Westphal, of course. Okay, so I just corrected that error for you. I was going to show you, since you didn't have, the other question, yeah? Yeah, okay. The error is where he has abducens. He says, fibers to the superior rectus muscle originate in contralateral abducens nucleus. That is not true. You know that. The abducens nucleus innervates the lateral rectus muscle only. It's supposed to be the contralateral oculomotor nucleus. And the same is true. The levator palpebrae receives innervation from the bilateral oculomotor nucleus. Okay, that's just typos. Okay, the other thing that, if you don't have, is there any specific questions related to his presentation? Okay. I'm sorry, way back there, yes?
I just have a question about the other ophthalmology lecture that we had.
Yeah.
Are we responsible for a lot of the other findings that are not neuro-related?
Not neuro-related. I guess the way I try to kind of summarize that is, Dr. Kimbrough talked about several different kinds of major diseases of the retina. The retina is part of the central nervous system. I think it would be good for you to know something about those diseases, but again, you don't have to know how to clinically recognize them from the imagery of the retina or necessarily how they're treated. Okay? What else can I say about that? Both of those, both Dr. Kimbrough's went over the visual pathways, which of course you must know, and the testing for the integrity of the visual pathways, which you must know, and the pupillary function and the tests that are used for that, which you need to know, and ocular motor movement and the pathways and tests, and what those tests reveal about the health of the central nervous system, and that would be stuff you would want to know. Okay. I guess the last thing I will do then is Dr. Bradshaw did provide okay, he kind of provided, well, this will go up on D2L. He provided a kind of shortened set of slides from his presentation. And I'm not sure that this helps you all that much, because what it basically says is that these are the slides that have the key information. And if you understand this information and how these slides all interrelate in terms of the action potential and resting potential and axon conductance and conduction of the action potential, then you'll be in good shape. But of course, many of the slides that are left out are the sort of explanatory ones that explain how this comes to be. Okay, so it doesn't mean don't look at those other slides. It just means if you understand these key concepts here in detail, then you'll be in good shape. So that might help you kind of focus on what it is that you need to cover and make sure you understand. Okay, we'll put that up in D2L as part of the review. Some of what Dr. Rodriguez has done in terms of you have some summaries of the pathways that the sensory pathways that you need to know. We'll also put up there. But again, that's just sort of help you itemize maybe what it is that you need to know and go back to the lectures and supplement your understanding and so forth of those key points. Do you have any other questions about the exam per se? It should be ready, from what I understand. It's supposed to be ready Tuesday morning, and I guess you try to download it ahead of time from ExamSoft and stuff. Yeah. Go ahead. Yeah, it's basically it's a multiple choice set of questions. It will be somewhere between 50 and 56. It's not completely finalized yet, questions. They're your usual A through E, most of them, E through E choices. There are some that have images associated with them, but it's not very heavy that way. And again, yeah, go ahead. Well, I don't know how to, they overlapped quite a bit. And as we said, we don't want you to focus too heavily on the completely clinical aspects of what Dr. Kimbrough was talking about. We're going to be covering the neurological aspect of it more thoroughly. But certainly the visual system and diagnosing the visual system is very important for assessing the integrity of the whole brain at all different levels. So yes, it's very important. Yeah. Mm-hmm. Okay. Yes. And as I said, don't memorize, go crazy memorizing pictures, right? Get the concepts and the information from them. I will speak to him about it and see if that's what he's going yeah. He hasn't generated it, or he hasn't given it to me to post, so I will remind him that he said that. Okay? And I was trying to kind of give you some of those guidelines in terms of, again, knowing your systems, you know, your pathways and how you test those pathways, knowing the pathways about oculomotor movements, and having some basic understanding of what kind of deficits would be associated with the specific kind of diseases that she mentioned without having to clinically recognize or treat them. Okay. But I'll have him, if you want something more formalized, I'll mention that to him. Okay. Does anybody else have? Yeah. Well, yes. What? Mm-hmm. Well, they are all in the lectures in terms of what you have to, you know, in a summary form. It's probably true that the doctors Kimbrough don't summarize them quite that way for you in their lectures. You need to know vestibular, you need to know auditory, you need to know visual, you need to know, what did I leave out? Taste and olfaction. Yeah.
I think some of the confusion, like Dr. Kimbrough talked about deficits that involve motor neurons affecting the extremities, which is not something, as far as I know, we've touched on.
No, and you wouldn't have to necessarily know that.
Sticking a cranial.
You're going to stick with the eye movements, but some of those eye movement issues have to do with, you know, they may be as part of the description, there may be other deficits that occur when they occur as well, right? So your description may include other things, but your focus is going to be on what are the eyes telling me? Okay, I mean, when you read one of those, you know, one of the stems for a question, it may indeed mention some things that you have not seen before, but don't panic. The question is going to be about something that you have studied. Okay, so it may say the patient has X in his legs, and such and such, such and such, and he's missing this function. Okay? You don't need to know where that leg thing came from to be able to answer the question, because it's going to be about something you have studied. Okay? Does that help? I mean, we're really, just don't get thrown by extraneous information that may be in a question, you know? Focus on what they're actually asking and how it relates to what you've already studied. So don't panic about that. I'm not sure I need to follow up a little more with your question about the other pathways. Mm-hmm. Right. Yeah. Yeah. Yes. Right. Mm-hmm. Well, yeah, certainly. Here, you want to?
Think about it. And that's why I use the visual system and the vestibular system as an example. I put my slide and the slide that Dr. Kimbrough used. Because most of the time, yes, we gave you a lot of information and this is the pathway, okay? But also we told you what is going on in each one of those nuclei. In part, that is because if we tell you that something is wrong, you can associate that deficit with that part of the pathway. Again, that's why I'm reinforcing this. You don't need to learn the pathway because you need to learn the pathway. We need to understand, if you will, the pathway. What is going on at different steps, okay, in different nuclei. And that is going to give you, because in the end, a patient is going to come complaining about something. And you need to know what is going on at different nuclei, at different levels, to make a diagnosis of what the patient has. Okay? That's what the way you have to think the pathway. Not just as a pathway per se, and again, do not study the visual system, do not study the vestibular system per se. Connect the dots. And that is going to also give you a sense of what is important and what could be not so important, if you will. Make sense?
I think I understand a little bit here. I'll say a little bit more. So when Dr. Stephen Kimbrough was talking about the pathways underlying problems with internuclear ophthalmoplegia, he said the details of this pathway weren't worked out. But then he did talk to you about the medial longitudinal fasciculus and what it interconnected and why, what that was important, right? When he talked about various pupil problems, he said, well, you can have a pupil that doesn't constrict because that input comes from the pretectal nucleus to the Edinger-Westphal, but it can still accommodate because that information comes from the visual cortex to control accommodation. That goes to the Edinger-Westphal, okay? So that's the kind of thing you want to try to put together, right, is understand that kind of pathway. So I think it's there, and we're not really challenging you to memorize, memorize purely for that sake, but to think about it in terms of understanding the issues he raised and what that tells you about the pathways. They're very clinically helpful and informative when they present this to you from a clinical orientation, but they don't necessarily present you with learning objectives from, the academic point of view. But I think you can extract from that what he talks to you about a specific clinical issue, that it would be important to know what you need to know, important to know the pathway that's going to be responsible for that. And I think he did go over that, although he didn't call them pathways all the time. So again, there is going to be in what Dr. Rodriguez has put together in his little review PowerPoint that I'm going to put up on D2L. He does show you some of those pathways specifically that we think you want to review. Okay.
Doesn't mean that those are the only ones that you have to study. Okay? I'm using some of them as examples. There are two from Dr. Kimbrough showing exactly what Dr. Harrison just mentioned, about the accommodation of the lens and the pupillar reflex. I'm using that as an example of, if you know the pathway, you know what is the lesion. And if you know what is the lesion, you have to know the pathway in order to understand what to expect from a test that you perform on patients. They go hand by hand. They go together all the time.
So nobody looks very happy. We're really not trying to stress you out about it. I'm just trying to kind of tell you how to approach your studying, really. I mean, I wouldn't go wildly through memorizing every slide. You know, you really want to extract from that the important information that allows you to construct a view of how the nervous system is put together and how damage in a certain place would be reflected in certain kinds of deficits. That's our goal. And of course, don't forget about the electrophysiology and the neurotransmission, because that's, you know, that's operating on a slightly different level, right? That's on the level of understanding your cellular functions and specifics about synaptic interactions and synaptic function. So that's not my forte, but that's there as well. Okay, I'm not really, I think, at this point, unless there are some specific questions, and if you have really specific questions and you want to come visit us individually or send us an email or, you know, something like that with a specific confusion, let us know. Otherwise, I will talk to Dr. Beaumont about if he's going to put up a specific set of learning objectives for the neuro-ophthalmology lectures. And those other PowerPoints will go up on D2L that would just kind of give you a little bit of a directive about where to focus. Just keeping you here probably is not going to be the best use of your time unless there's any other questions. Okay? All right, guys, and happy studying. Good luck. If anything comes up, just send us an email.